Graz, the European Center for Nanotoxicology.
Thank you for the introduction. The motivation to do or to study chronic exposure is that people are exposed to nanoparticles to an increasing degree, and we already heard several times during this day that accumulation can even occur after one single injection of an imaging agent, for instance. Cytotoxicity, in contrast, is most often studied or routinely studied in a 24 hours exposure, so not under chronic situation. And we wanted to evaluate in vitro models which are not primarily designed to do chronic cytotoxicity testing, and our goal was to study the cells more than 2 weeks. On the one hand, adherent cells, such as endothelial cells, and on the other hand, suspension cells. And then, in the end, compare acute to long-term results and to see if we find some role how the sensitivity increases. So the material were polystyrene particles of 2 different sizes in which to validate the system, and they have the advantage that they don't change their size so much, so they do not aggregate that much over time. Then we had also 2 samples which are more relevant, which are short carbon nanotubes on the one hand, and on the other silica aerosol nanoparticles. So the cells we used were on the one hand an endothelial cell lines, and we observed it for 28 days, and on the other the monocytes as an example for suspension cells over 16 days. The exposure system was on the one hand microcarriers. You see here the microcarrier, and they are populated by the adherent cells, and you culture them then in a small benchtop bioreactor in tubes. The system for suspension cells is called cell line, and it looks like a flask, but the cells are only cultured here in the so-called cell compartment, and they exchange the oxygen via a membrane here, and nutrients and people and things they want to get rid of by another membrane. And by this, this was originally being developed for antibody generation, you can get high density of cells. I'm sorry. Last not least, we had subculturing, where we subcultured 1 to 10 the cells and seeded them again. You see here and that cellular dye is in blue, then the nanoparticles in red, and lysosomes in green. And you see that the nanoparticles are taken up into the cells, and they co-localize mainly, this is shown in yellow, in lysosomes. Out of the 2 types of nanoparticles, or sizes of nanoparticles, only the smaller ones, here termed PPS 20 for 20 nanometers, reacted cytotoxic. Cytotoxicity was not very pronounced after 24 hours, but then in the longer very nice, thank you, I hope it helps. Thank you. But in the longer exposure, you see that after 7 days, already at this very low concentration, there is a significant reduction in the cell number. We looked a little bit into the mechanism, and there was little activation of apoptosis and also a little bit of membrane damage, but not very pronounced. For the short carbon nanotubes, multi-well carbon nanotubes of 50 nanometer diameters, you also see that they are not cytotoxic at up to 500 microgram per mil, at the short-term exposure, but then in the culture you get a significant reduction in the cell number. But what you also see for these particles is that they appear a little bit to recover from the damage. The second system we were evaluating was the cell line system, and it appeared that this was not ideal to do that, because you see here the growth curves of nanoparticle exposed cells, and you see the variation. So this system just created considerable variation between the experiments. So in this time, for this setup, the subculturing was better. And if you compare here the 100 microgram per milliliter acute cytotoxicity, there was not such a decrease in the dose or an increase in the sensitivity upon long-term exposure or longer-term exposures. The mechanism involved were very similar to the acute cytotoxicity, so membrane damage was seen and also indication for apoptosis. For the silicon nanoparticles, also the difference between the acute dose and the longer exposure was not so pronounced. It decreased from 200 to 50. The other goal was not only to look at cells, but to look where particles accumulate. We have also, in one of the previous lectures, seen how they go to lysosomes when they are taken up actively by endocytosis. So apparently this could be, lysosomes could be an organelle where accumulation might cause some damage. We used carboxyl polystyrene particles for this, for the simple reason because they are ingested to a higher degree than the plain polystyrene ones. And we used, again, the endothelial cells, but we have to serum reduce them to reduce their growth rate because we wanted to prevent dilution by cell division. We see here again that the nanoparticles go to lysosomes. So this is again the marker. So on the one hand, we have the red nanoparticles, on the other, the green labeled lysosomes. And if we quantify this a little bit, we see that the uptake after 4 hours for the smaller nanoparticles has already occurred. They already reached the lysosomes, whereas the bigger one, in the end, or not in the end, but at 24 hours, already also reach the lysosomes, but at a slower rate. We did this with 2 different markers for lysosomes. Therefore, we have here lysosensor and cathepsin B as label. To look at lysosome function, we chose again cathepsin B because this is an enzyme, a proteinase in the lysosomes, and another enzyme, lysosomal sulfatase. We could look at them by confocal microscopy, but also quantify the reaction by fluorometric. Then we look at the pH, which is also an important parameter for lysosomes. This can be done by 2 dyes, fluorescent dyes, where also quantification can be done, this time not only by fluorometry, by image analysis. 2 different programs, ImageJ maybe is known. Membrane integrity can be assessed by lucifer yellow, which is a dye which normally presents a dotted pattern, but if the membranes of the lysosomes are damaged, the dye leaks into the cells. This cannot be quantified really, but has to be scored by the person who is taking the images. What we saw in terms of enzymatic activity was that accumulation apparently had some effect. You see here that the activities decreased upon exposure to the particles compared always to the positive control here with its chloroquine. But the effect was not more pronounced after longer time points, 72 hours, but was stronger upon shorter exposure, so we could not confirm any more severe effect upon accumulation. Lysosomal function, these are images from, on the one hand, the negative control, on the other hand, positive control, as I mentioned, chloroquine. And you see here that it's quite easy to see how lysosomes get bigger and also more green in a way. And on the other hand, here also this lyso ID shows a higher signal in the exposed cells if lysosomal damage occurs. Example here for membrane leakage from the dotted pattern to more diffuse staining of the cells. But this is only here shown positive control versus negative control, and if I would show the images from the nanoparticles, from the carboxyl polystyrene particles, they would look exactly like the negative control, so we didn't see any effect there. So in summary, it can be not concluded, but effects, chronic effects, as expected, were seen at lower concentration than at the short-term exposure, what would have been expected. But the reduction or the increase in sensitivity was different. So if we had, or remember, these more sensitive cells, the monocytes, which reacted also in the acute cytotoxicity setup, their increase was not so pronounced, or the effect was not so much stronger upon longer exposure. We have also seen that adaptation might occur. If you remember the carbon nanotubes, the damage was more pronounced at 7, so initially, than at the end of the exposure. And then we notice only small effects of these polystyrene particles accumulation on lysosomal function. I'd like to thank the people involved in this work and the support, and you for your attention.
Thank you very much, Professor Furley. Questions? Well, probably we are already very close to the end of the break, so if there is no question, then I would like to thank you and finish this session, thanking everybody for coming, for your interest and your patience to hold out to the end of this very extended session. Thank you very much. Goodbye.